This video is for educational purposes only. Surgical site infections are a very important threat to patients' health condition during and after the postoperative recovery. Proper surgical hand scrubbing or washing decreases the prevalence of these incidents. This video aims to equip the students with correct and effective surgical scrubbing methods and hand washing techniques. A proper anatomical hand washing scrubbing can take up to 5 minutes and should be minimum of 3 minutes. There are several precautions that we need to take care before starting washing procedure. You must remove any kind of jewelry or bracelet from both of your hands and arms. You must ensure that your skin is free of any cuts, wounds or deep scratches. Your nails must not be longer than the tip of your fingers, and remember, any kind of nail polish is not allowed. Furthermore, any kind of acrylics, artificial nails and accessories are also not allowed. Finally, make sure that all of your personal protective equipment is on and intact. Your surgical cap should cover all of your hairs and ears, and your lanyard must be contained in your surgical attire scrubs. Your face surgical mask should cover your nose, mouth, and, if applicable, facial hair. Tear open an available antiseptic povidone iode or chlorhexidine sponge and place the package on top the sink with the tear facing upwards. Get enough soap from the soap dispensers located within the sink or from containers above the sink. First, start with a routine social hand wash. Once you finish washing your hands and arms thoroughly, remove your sterile surgical sponge from this package. Moisten the sponge under water by squeezing and releasing it. Clean under your fingernails using the brush side of your sponge within a back and forth motion for approximately 30 times. Remember, you can only use the abrasive brush side of the sponge for your fingertips. You must use the non-abrasive brush side for the remainder of the scrubbing process. Place your fingers side by side, including your thumb, and scrub at the surface of the palm 10 times. And turn the hand over and scrub the dorsal surface 10 times in a back and forth motion. Scrub the outside surface of the thumb, wrist to tip of the thumb 10 times. Continue to apply 10 strokes to the other side of the thumb and each side of your fingers, and do not go over the areas that you already scrubbed. Divide your forearm into 3 areas from wrist up to 5 cm above the elbow. If the sleeve of your surgical uniform is too long, you can fold it upwards. Then start scrubbing each 3 areas with 10 strokes from each angle. Like before, do not go back to the areas that you scrubbed already. Repeat this procedure for both of your hands and arms. After you finished, discard the sponge to the trash. Start rinsing from your fingertips and continue to the hand, forearm and elbow, moving in one forward direction. Always keep your hand raised above the level of your elbow. If you keep your hand below the level of your elbow, the contaminated water will flow to your hand and fingertips, causing contamination of an already cleaned area. Once you finish the rinsing process, your hands are considered as sterile, so do not touch anything. If you accidentally touch elsewhere, repeat the whole procedure from the routine wash level. Do not shake or wave hands and arms to remove excess water. Always keep your hands above the level of your elbows to prevent any unwanted contact, and this will also allow the remaining water drip from your elbows.